Hi everyone, I'm Tzu-Yao Chang from MIS. Today my teammate Bangdong Su and I will introduce you guys an e-health technology, RPN. We choose Napier Healthcare to be our evaluate object because it is famous for its telehealth service. The presentation is divided into the following 6 parts. First, let me tell you how we start our research. We search for several kinds of e-health service by the following keywords and choose one of them. Then we search that specific aspect deeper from various resource platforms for more materials. If you would like to understand more, you can just use the same keywords and go to the websites we list below. We are willing to have any further discussion with you. Let us start with the Napier company. Napier Healthcare Solutions was established in 1996 as a healthcare IT products and services company in Singapore. The primary services they provide are care mobility, hospital information system, the regulatory medical system, and RPN. You might ask, what is RPN exactly? RPN is an abbreviation for remote patient monitoring. It is a subcategory of home care telehealth that allows patients to use mobile medical devices and technology to gather their data and send it to the healthcare professional. RPN enables healthcare organizations to monitor patients outside of traditional clinical settings, which may increase access to care and decrease healthcare delivery costs. Common patient-generated health data which can be collected with RPN programs include vital signs, weight, blood pressure, and heart rate. Once collected, patient data is sent to a physician's office via a particular telehealth computer system or software application that can be installed on a computer, smartphone, or tablet. RPM is frequently used to help patients that require chronic, post-discharge, or senior care. By connecting high-risk patients with remote monitoring, it can notify healthcare organizations of potential health issues or keep track of patient data between visits. Additionally, RPN could be used by businesses that want to record workman compensation cases, making sure employees are on the right path to return to work. Then, how does it work? While RPN techniques can vary depending on the device being used or the condition being monitored, most of the technology includes similar components. The first is a wireless-enabled sensor that can measure specific physiological parameters and store the data it collects. This storage must also include a way to connect with additional sensors, healthcare provider databases, and related applications. Applications typically provide users with an interface to track or analyze the data and display treatment recommendations. The data collected by RPN devices is sent to the proper location and stored in a relational database. This allows healthcare organizations with wireless telecommunications data to be looked at as individual instances or in the context of entire health history. Often, the device can alert patients when a healthcare provider has looked over the data or detects an issue that requires the patient to come in. Next, let us talk about the features of Napier RPN. There are 2 parts in their service: telehealth platform and mobile application. Telehealth platforms provides a convenient dashboard for health management of the patients and residents. This function makes individualized and consumer-directed care to be possible. Moreover, the alerts can be configured for the incoming data on the dashboard for optimal interventions and increased efficiency. Interactive Dashboards is a role-based and user-centric dashboard designed for interaction between patients and health providers. Assessments function offers configurable questionnaire and analyzes the patient's condition using a scoring system. Care Management provides completely configurable care plans for diverse groups of users. Panic Alert let residents in aged care settings can alert and seek help with the panic button. Teleconsultations allows doctors and nurses to consult users remotely. Calendars and scheduling is used by healthcare providers for scheduling activities and upcoming tasks for patients and set those as reminders. Napier RPM app can be downloaded at either App Store or Google Play. The users can use the app and connected or manual measuring devices to perform vitals measurements remotely. Users can complete validated questionnaires and nurses can perform assessments. The RPM mobile app forwards all relevant information to the healthcare provider. As you can see, the telehealth platform is for health providers, and the app is for the patients. Thus, some of the functions in the app correspond to the telehealth platform. For example, the virtual visits and validated questionnaires functions which makes the patient connect with the care provider from the mobile device through teleconsult. Continuous education function can inform users on their condition with health tips, rehab best practice, and much more. Furthermore, users will receive reminders and notifications regarding upcoming health checks and other scheduled tasks. However, the app can be used by the nurses. The nurse app function can collect vitals for multiple patients or residents using secure one-touch authentication. The following images show the interface when patients are using the app. Next, Bangdong Su will evaluate the pros and cons of the RPM and provide recommendations for it.
Here we move to the part pros and cons. So for the benefits of RPM, to begin with, it allows data transfer between patients and health professionals in real time. The main benefits of remote patient monitoring is that it allows a patient to use a mobile medical device to perform routine tests and send test results to a doctor in real time without the necessity of visiting a medical institution. This advantage is of great importance for people with long-term illnesses who have to communicate with healthcare professionals more often. Doctors can consult sick people online with no need to wait for the appointment data. Secondly, improve patients' life quality. Incorporating RPM in chronic disease management can significantly improve a person's quality of life. Thanks to RPM, chronically ill people can spend more time at home with their families rather than at hospitals. A monitoring device is also able to inform patients about critical deterioration of health when they need to apply for emergency help as soon as possible. Thirdly, make healthcare more convenient. RPM allows doctors to reach out to potential patients. While many people can't stand going to clinics or for certain reasons can't afford visiting a doctor, RPM will bring free consultation with physicians right to their homes. This is how medical establishments can gain more visitors without overcrowding facilities. Last but not the least, save money. With RPM, it is not necessary to go to a clinic for a prescription or ask your physician about test results. Besides, due to the decreasing number of unnecessary hospital visits, medical institutions become less crowded and can faster admit patients who need an emergency help. However, there are also obstacles for the usage of RPM. Firstly, RPM is not available for everyone. RPM requires good broadband connectivity, which is hard to achieve for small healthcare institutions and rural hospitals. On the other hand, it's important to take into account that not everyone owns a smartphone, and elderly people often face difficulties in using modern gadgets, such as mobile phones. Then, there is skepticism between patients and doctors. RPM appears to be the least effective patient engagement initiative from the Napier Company's research. The researchers explain these statistics by the fact that the use of wearables is still not available for everybody. By the way, doctors that were taking part in the survey haven't noticed any improvements in chronic disease management. In addition, doctors are also concerned about the difficulties they can face handling received data. Some patients are afraid that their private health data can be obtained by third parties and used for dubious purposes. Thirdly, additional custom healthcare software is required. After the data have been collected, RT departments have to redirect it from RPM devices to electronic medical record systems by the means of multiple third-party applications. So what's more, the reliability is doubt. Popular fitness variables tracking physical activity appear to have large variations of accuracy with errors. The reliability of RPM data is called into question as well. The lack of reliability is the most serious problem that need to be fixed before devices and the applications could be used by healthcare providers. Then let's move into the future trend of RPM. RPM comes with a lot of promise and has evolved into a finer service than telehealth. It is going to continue evolving with time in terms of growth and innovation. The following trends are foreseen in the future for RPM. Under the situation of ensuring patients' information security. Firstly, relative organizations should improve the technology's application in RPM. Then, they can encourage patients and increase patients' adoption and utilization in RPM. Enhance the relationship between patients and the professionals is also very crucial. Thus, patients can trust professionals and professionals will also provide valid prescription and feedback. In conclusion, RPM are especially useful because they let the patients live their life while at the same time afford constant medical attention. The need for visiting the clinic or doctor is pushed to only deserving cases. Offline or online RPM devices are effective patient companions at all times. RPM can be used by even seemingly healthy people who may foresee health problems in the future. RPM will also continue to evolve with increasing awareness, utilization, and improving technologies. So here is our reference, and thanks for watching.